Hello, everybody. Hi, this is Aman Sharma. And since the last few days, since the Prime Minister in the night of Christmas surprised everybody with the announcement that vaccination for additional groups will start, he announced a precaution dose for 60 plus people with comorbidities. He announced starting of vaccination for children in the between age of 15 to 18 years of age. There has been a lot of confusion. So, there has been a lot of talk. There's a lot of confusion. I think people are also a bit confused. Even journalists are a bit confused. So we just thought of bringing together our two best health journalists in Network 18, Runjhun Sharma and Himani Chandra, who cover the sector very, very closely, to just kind of, put all speculation to rest, explain in very plain words for the people what exactly is going to happen from January 3rd. So I start with Runjhun first. Runjhun, first let us explain what is exactly happening with vaccination for children. Rather, we should call them teenagers, I think 15 to 18 years of age. Which vaccine they get? Do they get an option of two vaccines? Do they get an option of one vaccine? How will these two vaccines be, administered? Is it Covaxin, simple Covaxin? What happens with Zydus vaccine? What can you just declutter it for us?
Yes, Aman. In fact, to start with, 1st of January is when registrations for children in the country will begin. So anybody who is above the age of 15, born in 2007 or before, will be able to register through the COVID platform. Now you have two ways to register. Either you register through the documents that were already existing on the list. The children would have a passport, or they would have, in fact, an Aadhaar card as well. But school certificates for children also are going to work. So once you register on the 1st or the 2nd, then you would be eligible to go and get a vaccine in any government or a private center. You can also walk in. That option will be available for children. So you'll have to take your school certificate or your Aadhaar card or your passport, walk into a vaccination center of your choice. If you want a free vaccine, then you book yourself in a government center. If you want to pay for the vaccine, then you can book yourself in a private center. Once you go there, you only have one option, that is Covaxin for children. Now, remember, the Drug Controller General of India had only given the approval for Covaxin in children above the age of 12 on the night of Christmas. That was the same night, Aman, remember, when the Prime Minister, in fact, made those two big announcements, precautionary dose as well as vaccination for children. So Covaxin currently is the only vaccine which will be available for children. But other vaccines, for example, Zydus, which has been approved by the DCGI for 12 plus children, soon perhaps could be added to that ambit of vaccinations which are approved for children. But right now, frankly speaking, they don't even have enough stocks to cater to. And perhaps that's one reason the government is. So Covaxin, the only vaccine available for now.
And I believe, Runjhun, the second dose will also be the same interval as for adults, the same interval as the adults have seen of Covaxin for children. It will be the same interval.
So, as far as Covaxin is concerned, 28 days is the dosage gap. So if you're taking for 15 plus children, if you get your Covaxin shot on day 0, then your next shot will be given on day 28. 0.5 ml will be the dosage, which is in fact same as in adults. It's the same vaccine also, let me underline, which adults had got, but separate trials were conducted by Bharat Biotech to make sure that it's safe for children and also it's efficacious for children.
Right. So now we get to the second major point, which I think many people are not able to understand. For that, I'm going to Himani. Himani, what is the difference between a precaution dose and a booster dose? Nobody is able to understand the difference.
As Modiji named it as precautionary dose, the word itself says that this is a precaution. This is precaution for those who are frail and are elderly. So as we could see the letter that was issued by Ministry of Health to states yesterday, it also said that the people should take doctor's advice before taking this precautionary dose. This means the person who is the assumption behind this name is that the person who has got all the 2 shots might not be able to generate enough of the immunity antibodies against COVID-19. So this now the doctors will take the call whether the person is immunocompromised, whether there were chances that the two doses have been ineffective in that person, and now this is the right time to take an additional dose. So this is the reason we are calling it as a precautionary dose in an advent when the outbreak of Omicron has also been seen. Otherwise, booster doses, what the world has been taking call on, is about taking doses that can take, anybody can take booster doses, booster just to boost the immunity. That's a very general term. That's for people assuming that these are first generation vaccines. We don't know that how long their immunity will last. Some studies have in fact shown that immunity starts waning after a certain period. However, majority of the scientists I have been speaking to, they are saying that the vaccines that we have administered in India are quite capable of training the memory cells, which are T and B cells, so that the antibody levels in the lab testing may not be very high. However, as soon as coronavirus will enter into the body, the mechanism that vaccines have trained our cells for, they will get activated and start generating and producing more antibodies. So the debate for launching booster doses in India and the trials have been launched, while NTAGI is still debating over the proposal to clear the booster doses. However, precautionary dose, the clear difference is this is as a precautionary additional dose for those who are frail, and the two doses might not have been able to generate the enough immunity in their body.
So we are trying to explain it to the viewers here that the booster dose may actually come even after the precaution dose. The government may think about booster doses even after this precaution dose for a large age group, maybe the 18 to 44 category, the youngsters. And that booster dose, I believe, Imani, can also be different from the vaccine you got earlier.
Definitely, because there is a consensus within the government that the mixing of doses works well. There have been global studies that have been proving that. Specifically for Covishield, we have data to say that once a person has taken first and second dose of Covishield, the third dose of any other vaccine that was tested basically for Pfizer in the other countries had generated a good immune response. So we have enough data to say that mixing of vaccines generate a good response. However, for Covaxin, still there is not enough data because Covaxin was used just in India so far. So government has already started drives to to collect more data on that front. But yes, the mixing of doses is quite possible. Also, the trials for boosters have already begun. And permissions have been given. We have reported that Corbevax has been given permission. I think Covaxin has also been given the permission for the trial. Initially, also, Dr. Ella has said in some interview that Covaxin's third dose can be given 6 months after the second dose. So all those data collection, the process has started.
Yes. So very lucid explanation there on anybody who's confused about booster and precaution doses. Runjun, coming to you, also this important, all of us, most of us have parents above 60 who would be eligible for the precaution dose now. So there has also been a lot of confusion. How do you take your parents for this precaution dose? Like there was earlier the talk about doctor certificate. Now we're talking about doctor's advice. So do our parents need to go to a doctor at all? Or can they straight away walk into a vaccination center and say, I have a comorbidity, give me a vaccine?
As far as the protocol and guidelines are concerned, Aman, you don't really need a doctor certificate to get that jab. So if you're 60 plus with comorbidities, you don't really need a certificate. You don't need to upload that certificate on the CoWIN platform, or even if you walk into a vaccination center, a government one or a private one, you will not be asked to produce a medical certificate. Having said that, it is advisable that before you go and get your precautionary dose, you can have a little chat with your doctor, tell them about when you got your last dose, what comorbidities you have. And in that situation, a doctor would be better able to guide that particular individual whether or not it is a good idea for them to go in for a precautionary dose or not. So far, there shouldn't be a problem because remember, these are the people, 60 plus people who already have got their first and the second dose. And let me also here stress on the fact that just because you're a 60 plus individual with comorbidities, or say you're a healthcare worker or a frontline worker, doesn't automatically qualify you to take that precautionary dose or a third dose. you will have to complete that 9 months of taking your vaccinations to get that a precautionary dose. So that remains mandatory. The medical certificate, no, but it is advisable for our viewers, if you're watching this and if you're thinking whether or not you should take your parents who are 60 plus with comorbidities to get that precautionary dose. Maybe you just want to call up your doctor and have a word with them, tell them what the underlying health conditions are, and get their advice before you go in for that precautionary dose.
Yeah, that is very important. I think what Runjun has said. Do have that chit chat with the doctor. And one googly I want to throw to both of you in the end, because somebody asked me this. Can a teenager between 15 to 18 years go alone and get the vaccination without his parents? Has the government thought about that, Runjun?
So that in fact is a very interesting question. I'll tell you why. Because a lot of people that I've been speaking to, Aman, are essentially saying that the government's done a wonderful job with Har Ghar Dastak campaign. Why don't they even open it for children as well as the precautionary doses? Because some of these people would be elderly and children. They are under 18, remember, and they would essentially need a guardian to go with. Remember, there's also a 30-minute wait. You have to sit in that observation area. So possibly you can't have like a lot of kids sitting on their own. So parents will have to go in that sense. It's not mandatory, however. But yeah, that idea of starting door-to-door vaccinations also for children wouldn't be such a bad idea.
Yeah. Okay. We'll wrap up here. I think very lucid explanations coming from both our star health reporters in Network 18. Please follow their stories on on television as well as .com. Thank you so much, viewers, for joining us today. Thank you.
Thanks, Aman.